healthcare is challenging, and that's why you do it, because it is challenging and it is rewarding. But you just have to be consistent every day and you'll be okay.
Hello, everyone, and welcome to the Radiology Report podcast, where we are having conversations with the leaders transforming radiology today. You can find us on radiologyreportpodcast.com, Apple Podcasts, Spotify, Google, or wherever you get your podcasts. I'm your host, Daniel Arnold. I am so excited to welcome Joe Marino, CEO of openDoctor, to the show. Joe joined openDoctor to lead the company's sales, business development, partnerships, and marketing programs, and then transitioned into his current role as Chief Executive Officer in mid-2015. Joe brings over 20 years of experience in building businesses, creating culture, and driving positive outcomes at both startup and established companies. In his free time, Joe could be seen running along New York City's West Side pathways and coaching championship girls fast pitch softball. Joe, welcome to the podcast.
Thank you, Daniel. It's great to be here.
So I'm very excited to talk to you, Joe. You and I got to know, your company several years ago, actually, before I really dove into MRI Online. When we were doing some consulting for medical imaging practices who were trying to implement openDoctor. And so I've gotten to know your products as a consumer of them, and have always been fascinated by the space. So I'm excited to have you on, and thank you for the time. And I think our audience will benefit a lot hearing from what it's like implementing enabling technology into the imaging workflows that we see. But before we dive into openDoctor, first, just tell us a little bit about your career. How did you end up in healthcare software, and what ultimately led you to deciding to join openDoctor?
That is a good question. I've always had a preference, or really a love, for startups. I enjoy the process of building businesses versus being in larger organizations where it's much more difficult to get things done, at least in my view. So, and I think that's true from a product standpoint and a personnel standpoint. So I start with the basis of smaller companies that need to grow. And I had just finished being CEO of an intellectual property firm that filed patents to reduce the cost of those patents being filed internationally. And when that was finished, after a successful exit, I was looking for something or an industry that could benefit from technology. And I was really kind of lucky that I tripped upon openDoctor, and I knew a friend who knew somebody that was at the firm. And that's really how it started. And the more I learned about healthcare and their need for technology, the two were a perfect match.
Tell me more about this IP business. So is this a services business where, I have a patent in the US and then I'm saying, oh, I got to file it abroad, or was there some enabling technology in there?
You said it perfectly. It's we had a platform that if I have a patent, I put that number in, I check off the countries where I'd like to file that patent internationally. The system would automatically do the word count, calculate the cost for the translation, the filing fees, all of that done within seconds. Whereas if you had to get a law firm to do that, it would be countless hours of billable hours to do that. So we automated that process that allowed you to do it perhaps 50% cheaper than you could if you used your law firm.
Very cool. Very interesting business. So then you stumble on openDoctor because of a friend. And what is openDoctor?
So basically, we describe ourselves as a patient engagement, patient access firm with a focus, and this is the key point, in the radiology space. We had a pivot point somewhere around 2013 where we met a bunch of folks in radiology, and we decided that if we could schedule radiology, which is a 10 on the complexity scale, we certainly could schedule annual physicals. So we're basically helping our radiology clients allow patients to self-schedule. And then there's a bunch of services that happen after that patient schedules. But the magic is being able to schedule these complex appointments in real time.
Really interesting. So it sounds like the mission evolved a little bit from when you first joined. When you first joined, were you guys a little broader, just kind of thinking about patient engagement tools, across different industries of healthcare? And then you found this interesting problem in radiology and said, hey, there's some depth and complexity here?
That's exactly what happened. Is really the company was going down the path. Right about the time I joined, they were considering all types of appointments, healthcare appointments, pet appointments, a little bit of everything. And then as we started to narrow down the focus, we actually met people in radiology and realized, wow, this could be a game changer. And it started out with just scheduling forms and reminders. And now what's happened is everybody wants that full Amazon-like experience. So the early days, and still today, the most complex thing we do is the scheduling.
We came about our business in the opposite approach, which is we've only been in radiology, but every day people ask me, when are we expanding beyond radiology? But radiology is like this onion, and the more you peel it, the more interesting layers you find. And so we found plenty of depth and value for our customers by continuing to deepen our expertise in radiology. So I feel like you and I have come to similar conclusions about the industry. So for people unfamiliar with radiology, the idea that online scheduling is still not solved in 2022 would kind of blow everyone's minds. It certainly blew my mind. First of all, why is it complicated?
Well, I think the main difference is you're not scheduling. If you go for an annual physical, you're scheduling to see Dr. Daniel, and you're going to have a 30-minute slot for that physical, or maybe someone does a 45-minute slot. In radiology, you're scheduling an MRI of the left knee with contrast in a specific room in a specific resource. So you're scheduling down to the resource level. So you have to build a product that can handle the logic that drives you to the right location and then drives you to the right exam in the right resource. So it's very complicated to do that because there's a bunch of workflows within radiology that are so different from all other areas of healthcare.
When I remember when I was looking at this problem several years back, one of the other big challenges was the amount of information that you need from a patient. Is that something that you help collect? Remember, it's, if you've got metal in your body, it leads to a bunch of different questions. Or if you have certain health risk factors, does that play into the sign up flow as well?
Exactly. So we try to make it easy in the beginning. What exam are you trying to schedule? What's your health insurance? So we understand how long it'll take to get the prior auth. And then we work with our clients for each exam type to ask a series of questions that are qualifiers and disqualifiers. So what is your weight? Have you ever had metal in the eye? Are you pregnant? Things like that. And that logic will then go in the back end. And the patient doesn't know this. They're just answering normal questions. And once they answer those questions, the system says, okay, here are the locations that offer those exams in sequential order. Here are the resources and here are the times. So the pre-appointment questions, which we call them, are really the logic behind scheduling and really drive everything that happens, after that. So yes, that's exactly what's happening. You have to know which questions to ask, just as if I called in, we'd be asking similar questions.
And I imagine each customer does this differently. And then you have to hook into their different clinical workflow systems, whether it's, Centricity for scheduling or whoever they might use. So do you integrate into various technology platforms that are then driving workflow for those imaging centers?
Correct. So we're system agnostic. So we're an interface into their risk system. So whatever risk system they have, we'll interface into that system so that we're sending real-time messages to and from the client and openDoctor. So that those times that a patient sees are real times. Most of what you see in healthcare are really a request for an appointment. Give me a day or two, give me a time or two, and I'll schedule you. And then they start paying telephone tag. We're not doing that. We're similar to booking an airline ticket. If I select seat 14C, that's my seat. And that comes off of the web property that you were on, and it comes off of the airline's reservation system. Same thing here. We're taking it off of the wrist, taking it off of openDoctor, or putting it on the wrist, putting it on openDoctor. And then, of course, as you know, you have a lot of blocks and other things that complicate the schedule.
It sounds obvious to me that patients would want this, but is that actually the case? Do we see that when, someone implements an openDoctor solution that a significant, like what percentage of them would start then doing their bookings online? as opposed to
Yeah,
calling in?
so a lot of it is dependent on the client. How much are they marketing it? How much are they pushing it? But we'll see early results pretty quickly, around 10%. And then clients are now driving up to 30% going online. And we've just released some new products that help with those utilization numbers. So I think we're seeing, upwards of 30% for some of our clients, which is good considering it's early days for healthcare scheduling of appointments.
For sure. I mean, I think that mirrors just like general e-commerce is around 30% post-pandemic. I imagine I book most of my hotels online, but when you think about how early it is in the industry, 30% is a pretty big number. How did you end up as CEO? What was that journey like? Did you always, I was going to ask if you always wanted to be a CEO, but I guess you were already a CEO before. So maybe that was part of the plan all along.
It really wasn't part of the plan. Initially, I came in because I saw really I thought was a great opportunity to do something in healthcare and solve a problem that existed. So I wasn't really focused on being CEO because at a startup in healthcare, you're really doing a little bit of everything. So, I really focused on delivering the message. You were just out there speaking to as many people as you can, even though they weren't ready for the product. And then what happened is the board decided that given my background in business, in product and sales and marketing, it made sense for me to lead the effort because they realized it was going to be a monumental effort given that it's healthcare and they weren't ready to commit to self-scheduling. So that's when I took on the role of CEO.
And how did COVID impact the business? Was this something where all of a sudden everyone needed some sort of digital scheduling solution? Was it a tailwind, or did it kind of shut down any non-critical project, and so it became more of a challenge to get in front of folks? How did that play out?
So I think a couple things happened with the pandemic. I think one, it accelerated the use of technology by the general public. All of a sudden, you had a whole audience that had never FaceTimed, that never used Zoom, had never texted or sent documents or sent pictures over. So from a consumer standpoint, they became more aware of technology and what it can do for them in healthcare. From a client standpoint, it became essential that they found ways to interact with the client contactless. And so it helped our business.
Mm-hmm.
Even though you still had the healthcare cycle of buying and decision-making to live with, it really accelerated. So we were giving away certain products for free to have wait in your car technology so that when you arrived at the location, you would receive a text and then we would send that message to the front desk. And then when they were ready to see you, they would send a text back. So it accelerated the idea that, hey, we have to do things where we now have a digital waiting room and not a waiting room full of people standing close together.
So it sounds like getting people more accustomed to these online digital tools and ways of booking is probably putting some pressure on the existing healthcare systems to adapt. What are some of the challenges that you're hearing from your customers that openDoctor can help them solve?
Yeah, I think the biggest challenge, and it's probably no surprise, is that it's increasingly difficult to hire, retain, and train staff, period. And that puts an enormous amount of stress on those that are there to have to do, 3 jobs. So if you think about technology and how you can help that problem, it's like going to Whole Foods these days. There are very few humans that will check you out. Everything's done by self-service. So I think the inability to hire and even train, because with openDoctor, if you're a scheduler using us, you don't have to remember which machine has a weight limit, which machine is contrast, what hours the doctor's in. Everything's done for you. You just ask questions, fill in the answers, and the system does its thing. So I think that's going to be the biggest challenge that we're seeing is how do they get efficient? And we're starting to see this at a rapid pace of people saying, wait a minute, I have to solve this problem because I don't think that's going away in the economy anyway.
Yeah, no, it's when unemployment was not fully tapped, it often was an easier solution for folks to just hire another person than it was to integrate technology, because technology can be cheaper than a person, like on a, hourly basis, but integrating technology is hard. It's just like it's a hard project. You usually have some of the
Exactly.
smartest people in the company have to come together to figure out how to implement it, right? And you get your head of IT, your head of operations come together, you do a lot of work. And so to rise to the top when, you've got an existing workflow and, you could just hire another person who could do it. Oftentimes the math doesn't work out, but when there's no more people left to hire, that's not an option. So it's sort of counterintuitive that this full employment now is driving the drive to automation. Everyone was talking about the drive to automation maybe a half a decade ago, but now it sounds like the moment has come.
The moment has come, and it takes time, as you say, to implement this and to get it going. And look at, this is my favorite example. If you go to an airport and there's 300 people boarding the plane, 3 people have a paper boarding pass. The 3 people you're all staring at, if you go back a year and a half, maybe 2 years, probably more than half had
Yeah.
a paper, right? So
Yep.
there will be a tipping point where this is just common for everyone, but it has to start with the health systems having the mindset that we're going digital, just like every other industry has done.
Yeah. Well, and it's still just so counterintuitive that it would be such an effort to implement online scheduling, because you think about, I could open a restaurant tomorrow and hook into OpenTable, and I bet it wouldn't take me more than an hour to, be able to take reservations on OpenTable for my restaurant or even my chain of restaurants. So it's just one of these things where, like you said, radiology ends up being so much more complicated that it ends up pushing the timelines out further and further. What are some of the areas of innovation that you're focused on? So it sounds like you've cracked the nut on scheduling. Do you guys do billing? So once I'm in there now, you've got all the data that you need, demographics and email and everything else. So what exam I took. Are you getting into billing, or what are some of the parts of the stack that you're expanding into?
So in 2014, when I joined, it was hard to get anyone to speak about the internet, much less scheduling, and they were only focused on scheduling. Fast forward 2019, now and today, they want a full package. They want you to be able to receive the order. This is the exciting part. And then I text you that your order is in, and you click here to schedule the appointment. They want to be able to get the prior authorization. They want you to schedule. They want to fill out the forms. They want you to see what your copay and your estimated expense will be. They want to collect that payment. So it's a full cycle of digital tools that can work with the patient from before their appointment, during their appointment, and after their appointment. So it's changed dramatically in terms of all the services being valuable as a product. And I like to use Amazon because I think they're the closest to that experience. And that's what's happening in healthcare, including, which everyone told me I was crazy, allowing referring doctors to schedule patients in real time and put orders in through openDoctor and send them to the client. So you're engaging the radiology group, the patient, the referring doctor, and you have a cycle of interaction and engagement that you didn't have before.
I love that vision, but I think you mentioned 10 different companies, as you talked through that, right? Certainly
Yeah.
prior authorizations, a competitive space, different types of technology around the order from the referring physicians is a big space,
Yes.
billing's a big space. So are you partnering with others? Are you acquiring? How do you achieve this vision?
Yeah.
Just building?
Currently our model is some of it we will build ourselves, i.e. the referring portal, which is the sister portal to the patient experience. And others, we find partners that we feel can add value on the revenue cycle, the prior authorization, and we build out the necessary APIs to have this all be automated. So our plan is let others do what they're really good at, and we'll partner with them, and we'll do what we're really good at. Because if we tried to do everything ourselves, it probably wouldn't work. So we've taken a partner mentality.
Makes sense. So is, radiology still your core focus, or have you now started to expand to support other verticals?
Currently, yeah, radiology is our focus. We do have opportunities that come our way that are outside of radiology, and perhaps in 23 we'll look at the cardiology space or orthopedic space. But for now, there's so much to do within radiology that is still our focus.
Yeah, I know it can be hard to resist, right? Especially when you have a customer calling and saying, "Joe, I'll give you money. Take my money."
It's not always good to take the money.
Nope, nope. So 10 years into this thing, what have been some of your biggest learnings as you've been building this company?
So we could have a whole podcast on this, but I'm going to pick a few out that are my favorite. Maybe it's because it's my personality. The first one is hire great people, and that could mean a lot of things. But you want people to come in who are ready and willing to work and who have the stamina and the staying power to last in healthcare. So here at openDoctor, I'm the first person that any candidate meets. And if they get through me, then they go to various team members. So we do it the opposite way. Hiring great people that fit in and are willing to work hard is so important, because this is a long and challenging journey. You're going to have ups and downs, someone once told me, every day.
Sorry to cut you off, but I've never heard of the screening done in that order. And it's really clever, because what you have sometimes happen is you have all this, maybe 7 people have interviewed a person, 5 people have interviewed a person, and they bring it to the CEO. And if the CEO doesn't like them, well, you're kind of a jerk if you if you reject them at that stage. And so you got all this sunk cost into it, right? And then it doesn't feel like you're supporting your people and their decision. But that's really really clever.
Yeah, it's worked for us. And again, they might not like the person I put forth, and I'm not demanding they hire the people that get through. But
Right.
I have a good feel
the
for
inverse is true.
what will work and what won't work, and
Yeah.
it's challenging. So that's one, because hopefully your core team will be with you for a while. The other thing which you brought up is focus. You have to be good at one thing first before you can be good at everything. And a lot of times, as you say, people come with ideas and can you do this and can you do that? So for us, we had to be really, really good at scheduling before we could move on to other areas. And don't be afraid to do that. If someone comes to you with $1 million idea, perhaps you look at it, but all too often you're getting pulled in many directions, and that's not a good thing. So I would say stay focused on the one thing that you do great and then go from there. The other one, which is hard for a lot of people, it's build these lasting relationships. I network every single day that I've been at openDoctor, and I've been calling on people for 6 years who never returned my call. But they may, like the other day, I had 2 calls from people like that who are now in the job market, and they were looking to do things, or how could they help us? So just maintaining those relationships. Don't always think of it, oh, are they going to buy something from me? Build relationships, and it will help you long term. So that's a big one. And everyone in the company should do that, not just the head of sales or the CEO. And then lastly, I think perseverance. It's not going to be quick. You can have the magic serum, you can have the silver bullet. It's not going to be quick. Every day is going to be a series of ups and downs. So my advice is don't get too high and don't get too low, because healthcare is challenging, and that's why you do it, because it is challenging and it is rewarding. But you just have to be consistent every day and you'll be okay. But if you get too high or too low, it's going to eat you up a little bit.
Sound advice, Joe. I'm going to write those ones down and put them in the company Slack later today, because I think we'd all benefit from hearing it and remembering it and internalizing it as best we can. And I really appreciate you coming on the show and chatting with me a little bit about your entrepreneurial journey and sharing about openDoctor and the trends in radiology technology.
Yes, thank you so much, Daniel. I appreciate it, and I love your enthusiasm for the space. So thank you for having me.
Absolutely. Thanks for listening to this episode of the Radiology Report podcast. Be sure to visit us at theradiologyreportpodcast.com or subscribe to the show wherever you get your podcasts to join us for our next episode. We are always looking for great guests, If you have someone you'd like to hear on the show, please get in touch with us online.